Welcome to this Autism Ontario webinar. My name is Matthew Lay, and as always, I will be your host. Today, we will be discussing moving past the pandemic, considerations for autistic children and caregivers across Canada. We have a distinguished panel of guests and a lot of information to share from 3 studies that transverse how we did during the pandemic era, some of the innovations that occurred then, and what we should be looking at sort of post-pandemic. I know we're not really post-pandemic, but we are getting there. Now, before we get started and I introduce our panelists, I am going to review some housekeeping items. Today, we are on a bit of a new look interface, which should be very similar to what it is that we have utilized in the past. There's a Q&A box where you can submit your questions at any time. I will be aspiring to get answers from our panelists for you. Now, because of the way that the data is structured in this, what we will be doing is we will be taking your questions, we'll be consolidating them. We'll be entering into a Q&A session after each of our presentations before opening things up for a much more broad dialogue at the conclusion of today's events. But don't worry. Whenever you think of something, just submit it and we'll look to get you those answers. Once again, we have a series of resources that are built to inform our conversation. I will be referencing those, others will be referencing them, and they will be available to you throughout the presentation. And finally, if you have any issues, you can go ahead and click on the help icon, and that will basically give you some assistance from our team who are here and ready to help. So our first panelist that I want to introduce today is Jonathan Weiss. Jonathan, you've been with us before, so welcome back.
Thanks for having me. I'm really looking forward to being a part of this panel.
Great. So Jonathan, what are you bringing to the conversation today? What's your topic and why are you here with us today?
Well, as a clinical psychologist, I'm often really preoccupied with the idea of mental health and of well-being, whether we're talking about kids on the spectrum, family members, or more broadly, just people in any respect. That's one of my kind of major focuses. And so what I want to bring here is a consideration of what I find is a useful way of thinking about resilience and striving and growth. And I think that's a useful thing to be aware of and to think about what are the ingredients that we can bring into our day-to-day lives that we all have access to in some form or another that can help all people thrive, whether we're talking about parents, kids, or families more generally.
I like the term resilience. It's something we have all needed during this time, regardless of our situation. Thanks, Jonathan. I look forward to our dialogue just a little bit later. Next up is Vivian Lee. Vivian, thank you for joining us today.
Thanks for having me, and thank you to Autism Ontario and for inviting me. I am a new faculty member at Carleton University in the Department of Psychology. And today I'm going to be talking about some of the innovations that you had mentioned. We know the last 2 years during the pandemic, it's been really tough for families. But what I'm going to be focusing on is the way that families and service providers have adapted their supports to meet continue to meet the demands and needs of families. So I'll talk a little about 2 studies that we did and have published, and some of the results and some lessons learned.
Janet, thanks for being with us today. Maybe tell me a little bit about yourself before we dive into your content here.
Sure. My name is Janet McLaughlin. I'm an associate professor of community health at Wilfred Laurier University and co-director of the Laurier Autism Research Consortium there as well. Most importantly, though, I'm the proud mom of a 10-year-old boy on the spectrum. So I was inspired to study the impacts of the pandemic on caregivers after going through a little bit of that myself.
I can't imagine. And that's really what we're here to talk about today. And that is, with yourself anyways, is your study on how Ontario autistic families fared during the pandemic. And so I think we just heard the origin story of the study. It was after you went through it. maybe you can just start broadly and talk a little bit about the study, and then we'll get into your content.
Yeah, well, actually, if you just want to advance into the slides, it will present the study there.
Perfect.
So these are my co-lead researchers, but there are actually a number of others that will be present at the end. That includes Jonathan and Vivian here on this call. So it was a real collaborative effort. And we did it in partnership with Autism Ontario, which was really wonderful to have their support. So I'm thinking many of the caregivers on the call today may have even been participants, and you may hear your stories reflected back today. Yeah, so the purpose of this study was to hear from primary caregivers of children and youth in Ontario with an autism diagnosis under the age of 18 about their recent experiences in the context of the pandemic. And we were really looking at three main topics here, each of which is really big and could be its own presentation: child education, autism services, supports and recreation, and caregiver well-being. And as you can see on this slide, the survey included nearly 2,700 primary caregivers who provided answers about nearly 3,000 children diagnosed with autism, and some caregivers reported on 2 or 3 children in one family. 90% of our respondents were female, primarily mothers, while 75% of the children reported on were male. So to start, we wanted to assess the amount of in-person instruction time students miss due to COVID, or any reason really, including school exclusions. We found that 32% of students missed between 5 to 20 weeks, while 26% missed over 21 weeks of school in that year. It's the 2020 to 2021 school year, which is about 5 months, or about half of that school year. Now, although some parents were offered the chance for in-person learning, many were not. And as one caregiver explained, in-person would have been ideal. He needs that structure and routine that school provides. I felt that he fell through the cracks of the school system even more than usual during the shutdowns. Next slide, please. Okay, so overall, caregivers describe the impacts of the shutdown being predominantly negative, with worse social functioning and setbacks to child development being the most common responses, followed by worse mental health, lost supports and services, and worse physical health. A small minority of participants noted positive impacts, such as better mental health, for example, because in some cases, virtual learning led to decreased social pressure or bullying. Now, when asked which of the following recreation programs or activities their child participated in pre-COVID, which are the pink bars, and during COVID, which are the orange bars, here were their responses. We see a significant reduction in their typical recreational activities in all categories, and drops in participation were particularly notable for day camp use, swimming lessons, play dates, and visits with family. One participant commented, "It's been very difficult that everything is closed for recreation, swimming pools, drop-in programs that we rely heavily on. It was a full-time job to keep my child active and engaged despite these closures." Okay, so additionally, we see from this graph here that children reportedly participated in far less physical activity on average during COVID, the orange bars, when compared to pre-COVID rates, the pink bars. And now if you look at the very bottom, you'll see that the largest proportion here were receiving less than 5 hours of physical activities per week during COVID. Okay, moving on to the Ontario Autism Program, over half of respondents felt that the OAP met their children's needs either not at all or only minimally, while the other 47% felt their needs were satisfied to a moderate or high degree. Those children who had higher support needs were more likely to report that the OAP did not meet their needs. For those who expanded on their answers, the most common theme was that needed services were not funded, received, or available, while others discussed service disruptions due to COVID. Here are a few quotes. "Waitlists for speech therapy are about 1.5 years, which means using the one-time funding is not an option since it will expire before we get in. I have never gotten support on how to even navigate the support. So overwhelming. I said, forget it, and just survived." His window of early intervention was lost, waiting. So using the brief family distress scale developed by Weiss and Lunsky, The majority of caregivers describe their current level of distress being moderate, with over 8% indicating a high level approaching or in crisis. Many caregivers commented that their mental health was worse earlier in the pandemic, but it had improved by the time of writing the survey. For those who expanded on their answers, the most common themes were facing multiple demands, such as juggling childcare and work, as well as demands relating to navigating and accessing autism services. Unfortunately, many people, including those in crisis, reported not being able to access supports in a timely manner. And again, here are a couple of quotes. "I don't know what to do. I don't know who to talk to. There is no help from my son's school. I am lost. When we are struggling, it isn't fun to reach out and someone tell you there is no help and that the wait list is 6 months to a year. I have dealt with anxiety and days of crying and struggling and begging and no one and no answers." Nearly 70% of caregivers said that their mental health worsened somewhat or significantly during the pandemic, while for about 10% it improved. Now, those who expanded discussed the challenges of working from home while supporting their children and worries about their child as major contributors to their mental state. Again, a few quotes here. "Constantly juggling demands for multiple children during doing remote and trying to work remote, absolutely exhausting. Child needs a lot of support, and during COVID, we parents had to be a little bit of everything, parents, teachers, and therapists. As I'm the main caregiver, most of my time goes to her from 7 a.m. to 8:30 p.m., then anything that arises during the night, many, many sleepless nights. Working full-time from home and trying to help 2 kids with online learning was stressful and made for extremely long days, hard to find time for self-care. Being in and out of school due to COVID lockdowns, then completely shut out of school since April 12th has taken an emotional toll on me. My child going to school daily was my respite and her need for autism support." Around 87% of respondents said their mental health was somewhat to extremely affected by the challenges of accessing and navigating autism-related care. Caregivers reported spending an average of 6 hours per week advocating for and 9 hours per week navigating care for their children. This is a total of 15 hours a week. Many parents described experiencing depression or sadness, but anxiety-related concerns, including stress and worry about their children's futures, were even more common. Many people also talked about feeling overwhelmed, exhausted, or hopeless. Another quote here, "Time is passing. I see my kids growing and missing all the learning opportunities they should be provided with to help them develop. I see forever wait lists. It is heartbreaking and so frustrating. I cry every day." And another, "The advocacy piece is truly exhausting and heartbreaking. Research tells us what kids need, yet as a parent, I have to fight every single day for my son to get a fraction of what he needs. Advocating for 2 children is a full-time job and parenting them is another full-time job. I have 0 time for anything else." So just over 77% of participants also felt their physical health was somewhat to extremely affected by navigating and accessing autism-related care. Many parents indicated they were lacking capacity for physical self-care, including time to exercise or cook nutritious meals, and experienced increased weight, stress eating, and problems with cardiovascular health. This graph shows proportions of caregivers rating different supports or strategies as helpful to relieve stress. While the majority adopted healthy practices to try to improve their well-being, a theme we'll return to later, like exercise or educational sessions, a significant minority pointed to coping practices that may also be harmful to their health, such as drug and alcohol use and emotional eating. Okay, so a few takeaways of the main challenges facing families. First, in a climate of limited capacity resources, advocacy has become a full-time job for many caregivers. Many experienced really severe time constraints, for example, giving up sleep, work, or personal time as a result of these demands. Others experienced extreme financial pressures during long wait lists for services, during which they paid out of pocket for as much as they could afford. These combined challenges led to a state of constant or unrelenting stress, with consequences for mental, emotional, and physical well-being. Caregivers overwhelmingly expressed extreme frustration over long wait times for services, especially needs-based therapies, disillusionment and distrust of the government over the constant overhaul of the OAP, lack of knowledge of services or service navigation, frustration over the time and energy they must spend to advocate for and navigate services, and belief that OAP supports are critical for their child's development and well-being, and that they are urgently needed without further delays. So in conclusion, stressors that existed already for families pre-pandemic remain present. These were just combined with the OAP upheaval, long wait lists for needs-based therapy, and COVID-related restrictions to further impact child and caregiver well-being. COVID educational disruptions impacted both children and their caregivers, but those who continued with education in person fared better. OAP funding was welcome and sufficient for some families, particularly for children with lower support needs, while for others with high needs, it was considered a drop in the bucket. So we really need to consider the family unit as an ecosystem. Policies need to better support the entire family well-being, both children and their caregivers. And that's really the one main takeaway I'd like to leave you with, and one that I've personally experienced. Both caregivers and their children require supports for the entire family to thrive. We can't just focus on one or the other. And that's a theme we will return to with my colleagues later on. So thank you so much for your time and joining us today. I know many of you are so busy. We appreciate you coming, and our full report and recommendations, as well as an expanded presentation of these findings with my colleague, Dr. Schneider, are available on our website listed here. So thank you.
Excellent. Thanks so much. A reminder to everyone, you can submit your questions in the Ask a Question box below, and I will aspire to get you some answers. So you're in a bit of a unique situation where you lived it and then you studied it. And I think that sometimes, you reinforce what you experienced yourself, and other times you might have some surprises. So when you started dissecting the dialogue, when the surveys came in and the like, were there many surprises for you, or did you kind of see what you expected to see in relation to this?
Well, I more or less saw what I expected, but if anything, I just felt really privileged because my child was afforded in-person education. And for those who weren't, they were really, really struggling with that remote learning. And so I saw a huge difference there. And I did experience that during the pandemic at the very beginning. So I recall how challenging that was. But to see so many families not being provided with in-person education was really heartbreaking. The other thing was just the differences in the OAP experiences. So for a small minority of families who were still receiving what we call legacy benefits, they reported much better outcomes than those who were in the new interim funding or childhood budget model, for whom their children needed high supports but weren't provided with. So it was really a diverse set of experiences, with some families doing much, much better than others, depending on whether they were given the benefits they needed and depending on whether they had that in-person education for the most part.
And did you learn anything from the study or from the families that you would look to implement should something like this occur next time, or anything that kind of you wished you had done differently in hearing their responses?
Definitely making sure that the families who need those supports continue to get them. We've learned a lot through the pandemic about how to provide supports safely. We've learned about some of the interventions that can help to mitigate spread. So if we're facing more waves of this pandemic, I sure hope not, or if there's a new pandemic, we really need to not abandon families for the sake of infection control. We need to find better ways to make sure people are well supported, safely supported, and not leave families in this situation again where they're basically trying to juggle multiple roles on their own. And for sole parent homes, the challenges were just absolutely enormous, compounded on top of all of the other challenges. So we need to think about how to better support those families who might have compounded challenges as well.
Okay. One more question here. It was from a parent, and it might be good for the entire group overall, but being asked about do you know if there, in your study, did you find certain school districts that did more in-person learning than others? Is there, they're looking, I guess, for schools and for districts that sort of made sense if they wanted to have more in-person learning. Did you get any of that information through the study?
That's a great question. I don't have the answer, but we could look at our data and analyze it in that way to get the answers. So if that person would like to email me, I'd be very happy to do a special investigation and respond to that. I think it's a wonderful question, looking at the different boards as well as the different regions. And if there was a divergence in that, that would be really interesting to find out.
Excellent. Well, we'll be able to get you that data. We'll be able to get you that person's contact details, and we'll be able to connect you for that. And we might have some answers from some of the others on our panel. So thank you so much for that. Janet, we're going to move on to our next presentation, but we'll be back for our Q&A session at the end.
Thanks.
Okay, so up next we have Vivian. So Vivian, maybe you can. The question that you're going to be answering for us today is: how did autistic families and service providers adapt? Invention is the mother. Of necessity is the mother of invention, I think is the expression.
Something like that.
Something like that. So we know from our work during the pandemic that a lot did occur. So what I'm going to do is I'm going to give you control so that you're able to go ahead and press the next button and go through your slides. I'll be here in the background if you need anything, and let's talk about some of the good things that came out of this pandemic.
Yeah, thanks so much. And thanks again to Autism Ontario and to you for inviting us to participate in this webinar and the opportunity to chat a little bit about our pandemic-related research and some of the innovations that we've seen occur during this time. So, as Janet mentioned and highlighted from her report, autistic families in Ontario and really across Canada have had a really difficult time during the pandemic. Between social distancing measures like waves of lockdowns, increased unpredictability for families and parents, increased responsibilities and stressors, loss of supports and services. We know that the last 2 years haven't been easy. But at the same time, we've heard from some families who've had the capacity or the opportunities, or as Janet mentioned, the privilege to be able to adapt to and make the best of their situation. So we've heard from service providers like behavioral therapists, mental health providers, and even teachers, especially teachers, who are able to adapt their method of delivery of some of their services or programming so that they could continue to support families throughout the pandemic. So what I'm going to do today is I'm going to highlight highlight findings from 2 projects from our research teams that provide examples of ways families and services were able to adapt to this new quote unquote normal. And I'm going to review some of the findings from a study that explored how these online adaptations worked for families and maybe what didn't, lessons learned. So very early in the pandemic, with support from CIHR and later from funding, with funding from MyTax and Autism Ontario, we published a report and a paper where we wanted to very quickly identify published work from around the world that captured the impact of the pandemic on the mental health and well-being of autistic families. And the way we did this, the way we conducted the study, was using a technique called a scoping review. So what is that? So essentially what happened was Dr. Weiss's Ph.D. student and I worked with a librarian at York University to search relevant published work that included articles in journals, reports from organizations, not-for-profit organizations, newspaper articles, blogs, news reports, any information that we could find that gave us information about how families were doing but more specifically, whether and how mental health supports and other interventions and programs adapted in response to family service needs. So what we did is we did this entire literature search, and we found over 200 articles that matched some of our criteria. But really what happened was we distilled that down into 37 articles that really pertain to what we were interested in. And these 37 articles included published peer-reviewed work and other reports. And then we worked to synthesize this information in collaboration with Mark Spilstra from Autism Ontario, other researchers, and then a team of parents of children and youth on the spectrum. And we did this to ensure that our interpretation of the information was correct and that it resonated with their lived experience. So the publications that we found and reports that we found represented data from across Europe, Asia, as well as North America. And of the reports and articles that we reviewed, 10 highlighted examples of service providers who were able to adapt to deliver their services to online platforms or telehealth. So in the articles that were reviewed, our authors described how teachers, educational assistants, behavioral therapists, speech and language services provided at first at-home kits for families. So at-home kits included gathering materials from their programs, physical materials, putting it into a box, and then delivering it to the family, sometimes dropping it off on their porches so that they could socially distance. And so with these kits, the service provider would then work with the parents and continue to provide programming or support families as it provided programming at home. This was at first supported by frequent phone conversations and discussions, but later as we adapted to online platforms, this involved video conferencing using virtual platforms like Zoom or Microsoft Teams. So this was happening all around the world as we were trying to figure out how best to move forward and continue to provide services for families. And I mean, these findings aren't really surprising now that we've been through this for 2 years, and online programming and education is something that we're very used to now. But it was interesting to see how quickly these adaptations and some of these platforms were used and how they were used by professionals so that they could continue to provide care for their families. So at the same time, I think we're quite aware, right, that these online adaptations of programming is probably going to continue, and that there is ongoing conversation about whether these adaptations, like virtual programming, should remain even after some of these stay-at-home measures or social distancing measures have been lifted. And we're able to go back to in-person services, especially since some of these alternative forms of care might be more accessible to some families, right? Some families have said that this is much easier for them than in-person. Not all, but some. And as service providers and organizations are thinking about how best to continue providing these adaptive services to families past the pandemic, I think it's really important, at least for researchers, to really understand and add to the conversation about how feasible and acceptable virtual care might be for families, and whether there is clinical utility in using remote delivered interventions. So at the start of the pandemic in early 2020, I was working as a postdoctoral fellow with Dr. Jonathan Weiss at York University, where we were working on evaluating an in-person adapted cognitive behavioral therapy program for autistic youth called Secret Agent Society Operation Regulation, or SASOR. So some of the parents on this call, and maybe some of the researchers and clinicians, have heard about SASOR, but essentially it's a SPY-themed 10-week one-on-one program for autistic youth between the ages of 8 to 13. There are a number of activities that are meant to help them build emotion regulation and social skills. So some of the activities might include role playing, video games, and they work alongside a trained therapist for the program. It's a lot of fun. A lot of kids quite like it. And so in March 2020, when all in-person activity was halted, we as the part of the clinical team decided very quickly that we had to adapt the program for online and remote delivery so that we can continue to provide care for the families who were part of our study and who were really relying on us to provide them with care. So we took this opportunity to work with the SaaS developers, and we also wanted to investigate from the parents and from the therapist perspective what worked for them in this new delivery model and what didn't work, or how they made it work for them, even if there were challenges. So in the study, we had 11 families participate, and we had 7 therapists delivering the program. And we were able to measure using online surveys, pre-program and post-program variables. And we also interviewed the parents and therapists about their experiences receiving and delivering the program. So first, our results from a published study now, we found that parents did report an increase in their child's emotion regulation and social skills. So the kids in the program learned some new skills, even though the program was delivered online. So that was an interesting finding. Parents overall found that the program was fairly feasible and acceptable to them. It wasn't too hard to participate. And about 90% of parents reported that the online program helped their child achieve their goals. But in interviewing the parents, we were able to identify a few factors that were challenging to them. So even though overall they found the program acceptable, it was helpful to them, there were a few things that they wanted to note that were challenging to them that they had to then adapt to. So the first thing that parents noted was that although the program worked for them, they didn't think that it would work for everybody. Right? Not everyone would be able to participate in online programming. So remote and online delivery often requires access to technology. So a computer, tablet, a smartphone, and of course, high-speed internet to stay consistent when you're delivering or when you're receiving the intervention. And a good understanding, the parent had to have a good understanding of how to set up the technology. So this is something as a research team we were very aware of, and so we're able to provide that support. Again, not every program might be able to do that. And families of children who are on the younger end of our age range, so those between 8 to 10 years of age, and those who had more attentional or behavioral challenges found it really difficult to consistently engage in the online or remote programming. And parents had to be more involved in those sessions to help manage or de-escalate some frustrations. So at the same time, the therapists that we worked with who adapt and deliver the remote SaaS program echoed much of the same concerns that parents did, but they want to emphasize, and I'm going to highlight 3 key approaches that worked for them in kind of meeting some of the challenges that the parents had talked about. So the first thing was rapport. So they were very surprised and were happy to see that the building rapport with families was possible, even though the program was delivered online. So this is very important. So what they did was even before the sessions or the program started, they spent some time chatting with the family, chatting with the child, getting to know their individual likes, their individual interests, and they ended up incorporating those interests into the sessions as they went along. And they felt that that really helped them build a relationship online with the child and the family. The next part was about managing behaviors. So that was one of the main concerns that we had, was that as a therapist, they're not in the same room with the child or the family during the sessions. So they couldn't physically be there to help manage any frustrations that might have come up. So some of the things that we did to ensure the safety of everybody during the sessions was to ensure that the parents were close by, maybe not in the same room, but in the same house. Of course, everyone was in lockdown, so that was possible. We made sure we had the cell phone number of the parents just in case anything happened. And the therapist found that consistently validating that this was difficult, that this was different, and that they're doing so well was really helpful in engaging the child and making sure they stayed engaged in the session tasks. And therapists also noted that knowing when to push and when not to push in terms of going through some of the session tasks was really important as well. So last part of what we learned was being flexible was really important. So therapists talked about, sometimes walking into a session with a plan, but depending on where the child was that day, they had to be really flexible. They had to be quick on their feet in adapting what they wanted to do, what they wanted to achieve for that session. And to be able to know that with this type of intervention that they could do that. So that was really important for them to know that they could be flexible. Sometimes when you're online, you can't control everything. So being flexible in the way you deliver the intervention was really important. And so with the support of the SME Family Foundation, we were actually able to create an infographic that outlines some of the tips that the therapists used to deliver the program. And this might be helpful for therapists or clinicians who may be continuing with remote care as we continue on in the pandemic, hopefully moving past it. And it includes some suggestions on and some lessons learned from our study that includes pre, during, and post-session considerations and planning. And so that's available through a link, I believe, that I sent to Autism Ontario, so you can take a look at that. And I should also mention that the study at York University with SASO-R is ongoing. So if you're interested in learning a little bit more about that study or potentially participating, we'll put up the link as well so that you can connect with Dr. Jonathan Weiss at York and get more information about that. Great. So thank you so much for, again, having me and letting me describe some of our findings.
No problem. So I'm going to ask you the same question before I get to audience questions. Was there anything that came out of the findings that you found surprising? Like, were you surprised by some of the data that you saw?
Yeah. So I think in the first study with the review, we were really expecting everything to be negative, right? Like that. And we knew, we predicted that it was going to be much harder, especially for families with children and youth on the spectrum who had very complex needs. Much of what Janet had reported in her presentation, but it was interesting, and even working with the parents as we're synthesizing the information, was that there were some positives as well, especially some of the families being able to adapt to their new normal. How quickly some of the programs were able to adapt and innovate to continue the care, and how that information was being shared around the world, right? As soon as, one behavioral therapist thought about, okay, I'm going to put together this kit and I'm going to have an information session or sheet for parents so that can continue providing care, that information was shared with others in other countries. So that was really a pleasant surprise that was happening even during the pandemic.
Yeah, really incredible how we all sort of, not all of us, but many, came together in these ways.
Yes.
There have been some great stories through the pandemic. At this stage, did your study, or have there been any studies that measured the efficacy of some of the online learning programs?
Not the efficacy. So we with our study, because we don't have a control group, we just had the families who were already participating. It's hard. We can say that's effective. There's clinical utility, but the effectiveness would require a little bit more research. I haven't seen anything quite yet, but I'm sure there are people working on that research to look at really, is there a difference comparing in-person versus online programming?
As it relates to the virtual at-home therapy sessions, was there a general length of session that that was utilized for online?
Yeah, that's a really good question. So most of our sessions were about an hour, but on average, it'd be about half an hour to 45 minutes, depending on the age of the child, depending on the time of day that particular session was happening. So we did find that because there were rolling lockdowns, sometimes kids were spending all day online. And then at night, they don't really want to go and do an hour online session and intervention, even if it was fun. So that was a bit of a challenge. But for our age group, sticking to about half an hour, 45 minutes was feasible for them.
Was any training given to parents to help assist in the program or in the sessions?
Yeah, so the program itself includes parent sessions, weekly sessions that where the therapist would work with the parent and review some of the tasks that they went through, some of the skills that they went through, so that the parent could continue to support at home offline. They were provided with information sheets, access to all of the what we call gadgets or online gaming that the child was able to play and access. And so there were kind of homework sessions or homework tasks that the parents would work with the child to achieve offline.
One last question, and then we do have to move on. But we have a very active group. For those of you whose questions don't get answered directly, I know that we're going to try and answer them in the Q&A afterwards via email, or maybe we'll get to them during our broad Q&A session. But either way, ask your questions. We'll work to get you answers. You mentioned at some point about new skills and competencies that were learned throughout this process. Did you find that those competencies, or do you have any data about if those competencies were maintained throughout afterwards, if there was any retention, I guess is the key question there?
Yeah, that's a good question. So not for this particular study, but in one that we will be publishing a little bit later on, that looked at a group session, online session with the same program. We did see that there was a retention of those skills 3 months after they finished the program. So that was encouraging to see that during an online sessions, they learned some skills and that they were able to retain it even 3 months after they finished.
Excellent. Well, thanks so much. That was I would say uplifting, and which is something that we are looking for. We'll come back, Vivian, at the close. But now we're going to move on to our final panelist, Jonathan Weiss, Jonathan, I seem to have lost your camera here.
Oh, I'm here.
Oh, you are here. Okay.
Oh, that's funny.
Yeah, maybe just do a refresh and I'll riff while you do that.
Sure.
Yeah, and we'll wait for you to reconnect. So for everyone, while Jonathan is reconnecting, because we do want to see him there, Jonathan's going to be moving on to how do we help autistic families move forward move forward now. And there we go. Jonathan's back, looking good. So Jonathan, I'm just going to give you control of the slide deck, but you're going to pick off where Vivian left off, I assume, right?
Yeah, that's right. Exactly. So both what Janet had mentioned, as well as what Vivian mentioned. And I do want to underscore, I was trying to answer some of those questions about SAS-OR in the chat. So we are continuing to try to evaluate this virtually, and those questions that people had, if people want to participate in that research program, they can. It's a free trial. So if they're from anywhere in Ontario, because it's virtual, they can contact the information on the flyer and we could see if they're a good fit, right? There's never a one size fits all. And part of what's important about research is to figure out who's going to benefit from what. So we're trying to do that. There's very little in the sense of harm. So if parents are looking for something that might support kids' abilities to grow in their emotion regulation skills and that kind of strength, feel free to reach out. But what I'm going to talk about is, and I'm happy to chat if there are other questions about that program too afterwards, but what I want to chat in the next 10 minutes is really a bigger picture idea, as I alluded to in the intro, about what are the big ingredients that we can all strive to bring into our lives to promote thriving, and what are the lessons that came about even when we did research in the pandemic that are telling us about that.
Well, you're in control, Jonathan, so I'll leave it over to you to go through your part, and we'll be back for our Q&A.
Fantastic. So this is really, the take-home message is that when we're thinking about what Janet was talking about around the stresses and the strains that so many families have been placed under during the pandemic, one of the key aspects there, what unifies all of those examples, is what I would call a misalignment. When Vivian talked about an intervention that could be adapted, but that it seemed to be helpful overall, but that there were some difficulties and challenges for some kids and some families, that also speaks to a misalignment. But we can flip that in another way, that what promotes healthy development and what promotes well-being and what promotes not just a reduction of problems, but actual growth. And that's what we're all looking for when we're talking about the importance of supports and services that are timely and effective. It's not just because we want to reduce a problem, but we want to help children and adolescents and adults for that matter, because autism doesn't stop at any one age, right? We want to help them grow and thrive. So what do we need for people to thrive? And what happened even during the pandemic that might be related to thriving? People didn't stop growing as a result of the pandemic. What are those ingredients? Ultimately, it's about a goodness of fit, about an alignment between a person and what's in their context. Let me break that down for you for a second. Thriving, as I said, is about growth. What does that mean? Well, one way to think about thriving is the idea of what we call the 6 C's. The 6 C's are the 6 C's of positive youth development or positive growth. Things like experiencing competence. I can do things. Confidence. I'm effective when I do things. Connections. I'm connected to others. People care about me and I can care about them. Character. I know right from wrong. I try to do the right thing. Caring. I have empathy. Connectedness is really about kind of belonging with others. And most importantly, contributing to ourselves or to our family or more broadly to our communities. And before we jump to the point of, this is something for adults, in fact, no. Even children, when we look at children, at preschoolers or at elementary school age children, they show these kinds of elements that are developmentally appropriate. Connections to others, caring for others. Hopefully, as I was even describing those C's, you were thinking about, if you have an autistic child, you were thinking about your child saying, yeah, my child has these kinds of aspects. But what really is important about kind of the slide here is that it's not just about the C's. It's about how there's an alignment between, how do we get those C's? Between a person's strengths, that is, a person might have academic strengths, they might have cognitive strengths, they might have social strengths and so on. But they also have things in their environments that help them grow. It's not just about a person's skill. A person's skill within the context of a healthy environment is what helps us get those seeds. Said another way, if we took a seed and we planted it in healthy soil, right? And we provided some intervention, we provided some water, for example, and we provided that ongoing help. But if it was in healthy soil, it's going to grow differently than if the soil is not healthy, even though it's the same seed, right? It's the same. So it really is about and that health has to do with what does that seed need, right? What's within the context of the soil that really matters. So this involves, what do people say about this? Really talking about access to positive people in their environments, people that are warm to them, people that include them, people that watch out for that person, people that try to do things to involve them in activities. It doesn't mean special professionals per se. We're talking about people in their lives, family members, siblings, friends, relatives, and so on. It's also an access to physical resources and institutional resources. And more broadly, kind of actions and opportunities in their environment. So there's a whole host of different things that kind of are involved in our growth and development. one of the things that we did in terms of research is we tried to ask the question, well, if we were to ask parents of autistic people and people with other developmental disabilities, what helps them thrive? What is important to them? What's correlated? And we did this over the pandemic. What kind of responses would we get? So I want to share with you what that looks like here. So hopefully you're seeing the slide that says why autistic children and youth can thrive. Okay? That's the slide that I'm hoping you'll see here on the page. So during the pandemic, what we did is we surveyed a group of family members, and in this case, it's a smaller sample. This hasn't been published yet, so it's fresh off, right off the press. We had 135 parents of people with developmental disabilities participate. And I mean developmental. Some of these people had intellectual disabilities, and some of them they all had intellectual disabilities, but some also were autistic, and some weren't. And we asked the question of the parents, how much does your child show competence, confidence, connection, character, caring, contribution, these C's of thriving? And we didn't have anybody who responded and said, this is not applicable to me or my child, right? That asking these kinds of questions, people see these in their kids all the time, even during the pandemic. And when I mean kids, I mean children, but of all ages. Whether it's elementary school ages or high school, or in this case, even young adults. As I said, I take a lifespan approach, and autism doesn't end at age 18, and neither should our understanding of growth and development. But what was related to these C's overall? Well, if you were older, that relates to C's. If there was a family member who was there and present to support the person, and if that family member was in good health, you can go back, please, to that last slide, Allison. If there was a community, but beyond the family member that to support the person, if that person and if that family had opportunities to participate in community, that really mattered. So being able to go out for walks, being able to go to recreational events, being able to go kind of grocery shopping together, being able to go into our communities and to do things. And as we heard from Janet, this was actually a problem during the pandemic, but it varied from place to place and family to family. And those that were able to do that more had kids who they said were thriving more. We also found that the presence and involvement of positive, caring people outside of just the family really mattered, and outside of professionals. So neighbors, community members, that is informal social supports, not formal social supports, but informal social supports and connections, was correlated with how much children were noted to thrive. And lastly, communities more generally that are healthy and not divided. Communities, we looked at this across the province, and some communities had more tension in it, more disconnection according to parents, more stress within that community. And some were closer knit. Some, and we're talking about kind of those around us in our town, in our street, in our neighborhood. Those healthier neighborhoods were associated with thriving. So it's not just about the individual, but it's also about the context. And as I said, this is for all people with intellectual disability, broadly speaking. Now, what you see here in this kind of table of this chart is, unfortunately, there was a gap between those with and without autism, that while there's varying degrees of thriving, those with autism were thriving a little bit less, but why? So we did an analysis, and the end result is two things that are highlighted here. The first is that being able to communicate, and the more a person is able to communicate, the more that really accounted for one of the differences. And this really speaks to the importance of access to needs-based interventions that can support somebody's internal individualized growth. So learning to communicate, not necessarily with verbal language, but learning to communicate one's needs is an integral part of thriving. But the other and the most important aspect of what explained for why people thrived and other people didn't was positive individuals in that person's life. Not necessarily teachers or professionals, but people, family members, and people outside of the family that were in good health, physically and mentally. So we'll just go to the next slide, and this will be kind of just to wrap up. So the next slide, where we're talking about supporting families. Beyond interventions that support the individual, the really important thing is that families need to take care of themselves as well. With the pileup of stressors and strains, there's really two things or three things that big picture families can do to maintain that well-being so that families can thrive. The first is to ask the question of what are the strains and the stresses that can be removed from the equation? What can we take a step back from? And we saw this during COVID, where people said, I'm going to pick my battles. I don't have the resources to access and to address all of these. I have to take a step back from the stresses in my life when possible. The other aspect is to add capabilities and add resources. And the third is to take care of ourselves psychologically. And there's actually a lot of evidence, I'm not going to go through it now, but there's a lot of evidence that when families and carers and siblings, for example, participate in their own self-care, we see benefits for the broader family unit. And there are a lot of these kinds of interventions that actually exist virtually in our own backyard. And we can talk about that or circulate information about that later. The last slide that I'll leave you at is we need to do a better job at teaching our communities about how to include autistic people and their families. It's not just about accessing interventions per se, it's about creating an inclusive society. And we've been working with autistic adults to push more of this information, that the idea of appreciation of autism is absolutely integral. That if we only focus on the individual child, or we only focus on the family, but they grow up within a context that excludes them and creates barriers and has stigma associated with autism, we won't see them thrive. So a real emphasis, and this is why I'm so happy to be here talking with Autism Ontario and presenting this with Autism Ontario, is that addressing that stigma and in creating more inclusive society is really what's needed. So Matt, I know I went a little bit over by 2 minutes. Apologies about that. Back to you.
No problem at all. And just on that note, guys, we're gonna stay open a little bit past 1 o'clock. We know a lot of you probably have to go at that point in time, but we want to have a bit of a discussion with our panel, so we're going to go a little bit long today. Jonathan, I've talked to you kind of pre-pandemic, mid-pandemic, and now. As you look at the data from not just this, but all of the studies, as I bring in the rest of our panelists back in, can you let us know what you were most surprised about, what you were most encouraged by, any of the highlights from these that you want to share with the audience?
Sure. What I think I'm most encouraged by when it comes to kind of this research on thriving is that we actually see, Matt, a very similar picture to the research we did before COVID. That the same ingredients that mattered then mattered during the pandemic when it came to what impacted thriving. The discouraging part, or the part that might be predictable, that unfortunately was that some of those ingredients that were there pre-COVID were less accessible to families during the pandemic. Yeah. But it's the same ingredients that mattered. So going forward, so the last thing I'll say is when Janet mentioned, what do we need to do kind of to plan for the next time there's something, right? We have to answer the question, how do we create more resilient communities that are ready to stay connected with each other when these kind of stresses emerge?
Well, is it not true that the caregiving community or the medical community, has adopted, these new ways and it's not going away? I know it seems to me there's a lot more options than there have been. Have we seen a cataclysmic change in the way therapy is provided and these options being available long term? Is that what we are seeing?
I think there's no one size fits all. And what we've seen, the benefit is that we've seen a growth of the different methods that supports are being delivered. And now we have to make sure it's fine tuned to the person, that the right kind of delivery fits with the right type of needs. But yeah, we've seen a growth. As you said, the necessity is the mother of invention. Right? So we've seen a growth of some of these aspects. But what I want to really underscore is that it's not just about formal interventions. It's about our informal relationships with our neighbors, with our peers, with these things really matter as well.
Right. We do have a couple questions here that I want to get from our audience. And Vivian, this one's going to be for you. You had mentioned that there was parent instruction that happened sort of at the start of these sessions. Were there goals for parents that were included as well, or was most of the goal setting done for the child?
So Jonathan, you can jump in because you're more familiar with the intervention of someone who's delivered it. But my understanding is, at the beginning of the sessions, that the conversation happens between the therapist, parent, and child to set goals, not just for the child, but for kind of everybody that is involved. And so my understanding is, the parents get to also talk about what they hope to gain and understanding or knowledge that they hope to gain, and they are able to set for their child, not necessarily for them. Jonathan, do you have something you want to add to that?
Yeah, it's meant to be, it has to be a collaborative process. It has to be one where the only way to have an alliance is when goals are aligned. There has to be a fit there. And so that's an ongoing process. Goals can change from one session to another, but so that's about the relationship, and parents are really integral to that goal setting.
Okay, I've got a question here, which panel may or may not have an answer. If not, I've got one. But my son is 18 years old with autism, learning disability, and aggression issues. I am having a hard time getting help. We found a psychiatrist, but he can't help us for too long. I think we've only got one more visit left for him. Once the person reaches 18 years old, there is less help for them and for the parents in this caregiver's estimation. Are there any recommendations from our panel today regarding help for those who sort of age out of the youth programs that are available?
So I'll look to kind of Janet if there are kind of lessons learned from the survey around what was useful for those at that 17-year age point. I'm not sure if she's frozen or not. But while she's coming back, maybe I could say that's a very common, that issue around transition age is really common. You're not alone in that. In terms of kind of visiting, a really integral aspect is the transition planning to the adult sector. And it really depends on where you're located. Certainly, one place to reach out to is the Azrieli Adult Neurodevelopmental Center at the Center for Addiction and Mental Health. Even if you're not within their catchment area in terms of actually providing ongoing psychiatrist support, I think that reaching out to them and explaining where you're at and trying to find the adult-related mental health services that exist in your area, they might be able to direct you to that. It really is about transition planning, Matt.
Yes, and we also have clearly Autism Ontario. Service navigators are there to assist where they can, and a recommendation from our audience that the Autism Mental Health Literacy Guide is very worth taking a look through. It includes a lot of insight contributed by autistic folks.
Yeah.
Okay, so with that, we've reached the end of our list, I think, of questions. Oh, sorry, Janet, are you back with us? Yes, I've unmuted you now.
Okay, yeah.
Perfect. I think Jonathan directed a question to you. Did you hear anything about that? And if no, okay.
No, the wonders of virtual stuff.
Perfect timing.
Perfect.
Yeah.
So the question was in regards to, did anything in your study, did you find sort of anything that would be helpful for those who are getting to that 17, 18-year-old kind of range? We had a question from a parent who was really struggling with getting assists as their child sort of aged out of the youth demographic.
Yeah, that's a real conundrum. That's what many people call the cliff. And our study really did focus on people under the age of 18, not because autism ends at 18, but because the services change so much. And so I know from talking to people at Autism Ontario that there are some excellent supports and services that Autism Ontario offers to help people plan for that transition and to help make them aware of all of the services that are available, as limited as they may be. So I would recommend getting in touch with the Autism Ontario adult branch and getting those supports. It's not something that our study looked at because we were focusing on the younger demographic, only to say that those parents who reported at that age range of that higher teen years were all facing that same conundrum. especially again, when they had children with higher support needs who weren't expected to maybe live independently. That thought of, well, what will they do all day if they're not in school?
Right. It's not just about supports from psychiatrists. It really is a cliff, as Janet was saying, across the board, unfortunately. It's great to know that. I see here to email webinars@autismontario.com for that information.
Yeah, we'll get that directed off, but also we're going to connect that person that asked that question into the adult group as well. Whether it's convenient timing on internet challenges or the fact that we are 5 minutes past the hour, I think it is time for us to wrap up just a little bit. Before we go, I'll give it to you first, Vivian. Is there anything that you'd like to leave our audience with before we adjourn for the day?
I think that from my presentation, I think that there's been, again, lots of innovations that have been developed over the pandemic that we may continue to see over time. But as Jonathan said, it's not one size fits all, that we really have to concentrate on individualizing and tailoring that care to our families and to the individuals, and to not just concentrate on the interventions, but also kind of the indirect supports that are going to help family thrive.
Excellent. Jonathan, before we go, one last word.
I'd say, I'm looking forward to this ongoing conversation, Matt. I think that, we need to work together as a broad community to support the alignment across peoples and places and policies. And that's something we all have a role to play in, whether it's a parent, an autistic person, or a host, a webinar host, or a researcher.
Janet, any last thoughts or last words before we wrap up today?
I'm sorry, my connection broke, so I haven't heard what others have said. I would just say, I really like Jonathan's for about the good soil. And in addition to family and neighbors and friends, I would say my findings really emphasize that good soil was good policy, where in-person education is afforded, needs-based therapies and services are provided, respite, social recreation, and physical activity programs that wrap around that family are available. And so I would really, just emphasize the importance that although parents can do certainly whatever they can in their own environment to improve their own well-being and thriving, without that broader policy support surrounding them, it is really challenging. So as a society, we need to think about how to make sure all of those supports are in place to present the best possible environment for that good soil and development of all of us.
And with that, I would like to thank you. I would like to thank all our panelists. I, for one, have left feeling quite positive about how we've transverse this pandemic and come out the other side. I'd like to thank our attendees for your participation, your questions, for sticking around a little bit longer with us today. A reminder, this webinar will be recorded and available on demand at the Autism Ontario website. If you know somebody who you think might find this information valuable, please share and share alike. The more people we get through the program, the more webinars we are able to put on for our audience. On behalf of my panel, Autism Ontario, and myself, I'd like to thank you, and we'll see you on our next Autism Ontario event.